and with Mike's assistance.
All right.
Okay.
Thank you.
All right, Megan, let me, for the time being, what I'm going to do is mute everybody. So try to save your questions for a little bit later. And then I'm also at the same time going to put Megan up as the speaker, so that we can all see her. Then we'll revert back to this gallery view and take questions and so on. And also, Megan, I am in the process of recording, if that's okay.
Yep.
All right. So with that, let me just mute everybody and change the view. So Megan, why don't you, okay. There you are. Now, when you want to, if you want to show anything on the screen, just let me know and I'll, well, actually, just a second. Okay, you should be good to be able to share your screen when the time comes.
Great. Okay. Can you hear me okay? All right. Great. Thank you so much for the invitation. I'm so sorry. It's been 3 years since the health department, or more than 3 years since the health department has joined you all. So I'm so glad to be here. I moved from New Orleans a little over a year ago up to Vermont, and I had been a member of our local Toastmaster, one of our local Toastmasters clubs for the last 3 years there. So, and I miss them a lot, and your group reminds me of them. So this is very, very touching. So I'll go ahead and get started. As Michael shared, I am the district director at the Bennington Office of Local Health with the Vermont Department of Health. Vermont, I can do just a little bit background, has a centralized public health system. That means that public health is managed centrally at the state level. You'll go to some other states and public health departments could be at the county level or even more local at a city level. So if you happen to be in Texas, every Texas county has their own public health department, like over 100. So Vermont's a little bit different in that we've got a centralized public health system, and each county has its own health department there that's centrally. So I'm a state employee, I just happen to be domiciled in Bennington. So there's 12 altogether. There's 11 other me's across the state that are working within their communities as well. So I'll go ahead and share my screen. Let's see. Nothing groundbreaking, just a little bit of information. The communities we serve, like I said, every town in Bennington County is served by our office. Any services that we have available are made available to any resident within the entire community. Our office is located, if anyone's familiar with CCV, right on Main Street. We're located right behind there. So not a lot of people know where we are. We don't get a lot of traffic into our building for a lot of our services are handled. We make a lot of referrals out to the community, but there are a few things that we do handle in our office, and I'll get to those in a second. In our office, there are, at this time, we've got 9 staff total, a mix of public health nurses. We also have emergency preparedness. We also have our WIC staff as well. Right now with COVID and telework, all of our services are now online. So we're able to move our WIC services to teleappointments. We have put on hold our immunization clinic, but we're able to do everything else virtually. And a lot of what we're doing right now is COVID response. So I'll share a little bit about that and what it looks like at the district level, and as far as what myself and our staff are involved in. So a lot of the work that we're doing currently with COVID is around guidance and education. So pretty much any healthcare provider, any school, long-term care facility, work site, As I'm sure you're all aware, there's a slew of guidance for all of these facilities and all these different agencies. And we do our best to keep up on that guidance, which is ever changing. And so our staff is available to field questions from the public, as well as make recommendations for working with our state partners, specific questions such from schools or from childcare providers. We're working really closely with other divisions so that they can get the most up-to-date information from the subject matter experts. But we work to kind of vet a lot of those questions and get people where they need to go. One of the biggest activities that we've taken on since COVID started is our pop-up testing. At this point, that's taking place every Monday from 9 until 3 at Bennington Rescue. That's over on McKinley Street. It's a great setup. We actually have drive-through testing set up there, which is unique. The other district offices throughout the state do not have this model. So we're a little lucky. We're very lucky that we were able to run that with the help of Bennington Rescue. We actually have people drive right through the ambulance bay, which is great. It is protected from the weather, so we can have our pop-up clinic rain or shine, and it's great. They've got a huge parking lot and driveway, so it's been very, very smooth. We can see up to 75 people every clinic, and we've been filling up every week. And that being said, we also take quite a few walk-ups as well. So for anyone who has had a recent exposure and are unable to get in through their provider, we're able to take people, no questions asked. When people come through, we don't ask for ID, we don't ask for insurance. It is a free service at this time, and we just want people to have that kind of accessibility. So those pop-up sites will continue through the end of August, and I've heard that we might be going into September with those as well. Some of you may have heard that we ran a pop-up testing site in Londonderry. Yes, that was just yesterday. Oh my goodness. Feels like a lifetime ago, but it was just yesterday. Was it yesterday? 2 days ago. I'm sorry. It was Wednesday. At that facility, or at that pop-up, we tested over 300 people from the community. There was some concern about some community level exposure, as well as some worries due to a situation in Manchester as well. So it was a very busy testing day, but we were able to set that pop-up up in less than 36 hours. So we're very flexible in what we can do and where we can go with our testing when we need to. Facility testing is something else that our office manages. This would be in the case of any kind of congregate setting. So a situation at a long-term care facility, senior assisted living, where there was one positive case or two cases that had COVID symptoms consistent with COVID, we would be able to send a team in there and do facility-wide testing as long as specific criteria was met. We've been running these kinds of facility testings all over the state, Department of Corrections, at long-term care facilities, at girls' homes. It's really wherever we're needed. And so those happen also very, very quickly. And I noted too, supporting other districts in that with staff working remotely and being pulled in all kinds of different directions, our staff is often asked to go help out in our neighboring communities. So I've worked in pop-up clinics in the Brattleboro area. My staff have been up to Rutland. At times we've been pulled up to help also as far as Burlington when the outbreak first happened there as well. So we're very nimble in what we're doing right now, and we're trying to be where we need to be and providing the best information as possible with that. And I'm sure most folks are sick of seeing this, but this is for most questions, we do refer people to our COVID website at vermont.gov. Very helpful. It's great to find all the information. We found out this morning the most visited page here is the travelers page. Go figure. So we also have quite a slew of services at the health department that aren't related to COVID, although everything is related to COVID right now. One of our bigger operations within our office is our WIC services. For those who aren't familiar, WIC is Women's, Infants, and Children. It's a supplemental food program that is targeted at prenatal women, breastfeeding, and new moms and children up to 5. The program is also available to folks who are fostering as well. WIC includes nutrition education and breastfeeding support, and it also includes a food benefits package for families that includes great grocery items, bread, cereals, produce, dairy, and also formula as well. So it's a big help to families, especially new families. We've got 4 staff that work in our WIC team, and we have currently around 700 to 800 families that currently participate in the WIC program in Bennington County. Our school health program, it works with the 16 schools in the county, and each school has their own school nurse. One of our public health nurses works as the liaison between them. You can imagine as schools are getting ready to get back into session, hopefully in the fall, that these school nurses will be very, very busy, making our school nurse liaison also very busy. But she works to help school nurses navigate school age immunizations, infection prevention within the school. If there's an infectious disease outbreak within a school, she also works with schools very closely for that. Our immunization program, it used to be a lot more robust. We used to do a lot more immunizations within our office. A lot of that work has moved to providers. So Vermont has a vaccines for adult program and vaccines for children program. It provides free immunizations and vaccines to healthcare providers that participate. So we were able to move a lot of that operation from our office out to our providers. That being said, some people are really used to coming to the health department for that service. And so we do still offer a monthly immunization program or a monthly immunization clinic for those who need it. That's ramping up probably in September again. We'll be able to see folks in office for that situation. We also have a maternal child health coordinator who concentrates on our safe sleep program, breastfeeding advocacy, healthy play. She really serves as a resource to community partners and also works really closely on the Children's Integrated Services team as well. Lastly, we also have our alcohol and drug abuse program. A lot of that work focuses on supporting our regional prevention partner, which is the collaborative out of Londonderry. They work really closely with preventative services and youth services, and we serve as a technical support for that program. We also provide Narcan training and also other grant support in the area. That was a lot of information. I can be done sharing my screen, Michael. And I'm happy to take any questions. I ran through all that very, very quickly, but I do have to jump off at 1. I'm so sorry. I should have mentioned that.
Okay. Why don't I unmute everybody? And let me also go to gallery if I may, so we can see the other faces. Questions for Megan? Sally.
How are you working with the schools in terms of, could you give us more detail on the work that is getting the schools prepared? Because, I think we're all very anxious about the health of our children and our teachers and the people who work in the schools.
Absolutely. So the Maternal Child Health Division is run by a woman named Dr. Brina Holmes, and she and her team are creating similar guidance to the kind you would see for like a long-term care facility. So guidance on cohorting, wearing masks, number of children per classroom, signs of symptoms, when there is a positive case, how a school should respond. There's a lot of, I would, and Beth could probably speak on this, like HIPAA issues when you do have a positive children with a positive test result, and really for any disease, that you want to protect the privacy of that student as well. So there's a bit of nuance that goes into when there's a positive case in a school as well. But really robust guidance is being developed for the schools. And the hope now is to get in front of that and prepare schools for when things are in session, so people aren't scrambling to get things together, and they've got all the tools they need to be safe.
Thank you.
All right.
Rod,
In light of Jerry's comment, which politician is going to make the decision on going back to school?
I could not tell you that. I would hope it would be based on epidemiology.
Good answer. Tom.
Megan, in the banner today, they talked about the outbreak in Manchester and the testing methodology. What testing methodology is the pop-up center using in Herrington?
Yeah, we use the PCR testing. So it's a nasal pharyngeal swab, and it's PCR. So that's the one that does provide that confirmation, confirmatory testing. It's a little bit different than the antigen testing. So yeah, the state does use that one at all our pop-ups.
Thank you.
Yeah.
I guess I have a question. What are your recommendations on if people believe they may have been around someone or a large group, but they're asymptomatic? What do you recommend people do get tested?
So the best recommendation, and this is something too, we're kind of seeing statewide, and that folks, immediately after they've learned they've been around someone who may be positive or it did test positive, that they're looking for that test like immediately, like the next day, the next 2 days. And based on what we know about the incubation period of COVID, you really want to wait up to 5 to 7 days after that potential exposure to seek out testing. At that time, you've gone through the incubation period. The risk is if you get that test too soon, that you might not have a significant viral load that the test will pick up anything. It might give you a false negative. So we ask people to kind of keep in mind that 5 to 7. What they also found is after 5 to 7 days is when symptoms might appear. So if you've had a potential exposure and then all of a sudden you're starting to experience symptoms consistent with COVID, that gives you a good indication that you might want to reach out to your healthcare provider as well, because they'll get you in for testing based on that versus going through a pop-up testing, which is for asymptomatic people. We hear a lot of people that are like, oh, 2 days ago, I was at my cousin's house, and we're like, hold on, it doesn't feel great to wait, but it really is in the best interest and really gives you the most accurate result. Did that answer your question, Dana?
Absolutely. Yes.
Megan, is there any, what sort of information do you have on what kind of provisions for contact tracing within the state?
So our contact tracing team has been very busy since the start. And I don't know if folks already know this information, but when a laboratory, UVM or the state lab or any of our third-party reference labs has a positive test result, that positive test gets reported to the state. That positive test result triggers our contact tracing team to reach out to that person and start to do basically an investigation, find out when their symptoms started, a potential exposure. Do they work in a long-term care facility or Department of Corrections? Are they in childcare? And so that process usually gets started within 24 hours of getting that positive test result. That ebbs and flows with staffing and the volume of positives that come in on any given day, but our contact tracing team has been very on the ball. And I should mention too, the folks who received the positive antigen test, it triggers the same response from our contact tracing team. So they still are going to follow through with that same due process with that positive, even though it's a slightly different test. And it's more of a presumptive positive versus a confirmed positive, they still go through the same contact tracing process.
Great. 12:57, so maybe one more question. Jane? We can't hear you, Jane. I'm not sure.
And I can hang out for a little bit longer if there's questions too. I want to be available.
Yeah.
Okay, am I on?
Yes.
Okay, so this is a real situation. If someone in Manchester's spouse, someone in Manchester tested positive, the spouse happened to come in contact with someone else. Now, the spouse is asymptomatic currently. Does that mean you wait a week for the spouse and then you find out another week later whether the spouse is working with might also have it? Or does it take even longer than that?
It's 5 to 7 days after the most recent exposure.
Okay.
The last time that they were in touch with you, that they were within the guidance is within 6 feet, more than 15 minutes.
Okay. Good, thanks.
Great. Rod?
Does the health department doing anything to try to publicly convince the idiots that won't wear masks that they should?
It's funny, I almost included they just announced a new campaign today, and it's called, there's these very beautifully colored posters, and it's an I wear a mask and because. And there's, I wear a mask to keep my family safe, because I take care of people. And there's a whole slew of them. We'll be making those available on our Facebook page, and it's something I can share, Dana, with you as well to send out. They're kind of the 8 by 11, can be easily printed. We even made one that has blanks. So, we'd love for kids to take them and fill them out. Like I wear a mask because I want to go back to school this fall. Kind of gives people, just a positive reinforcement for the behavior instead of a, punitive approach. We're trying to make it so that it's, this is our social contract to each other. And worst case, you have a piece of cloth over your, face, and best case is that you keep other people healthy. So that's our approach right now. We'll see. It might look a little bit more aggressive in the future.
Let me follow up with kind of a Jerry Albert comment. I was down at Stop and Shop the other day, and my wife and I were putting our masks on, and we're walking into the store, and here comes one of these guys that's like non-mask, I guess, and he's got a T-shirt on, and he goes.
Oh.
It was just pretty funny to watch.
Yeah, it's funny. It's I don't know for anyone else, but I've started walking into the store and I'm like, oh no, like I hope no one sees me. This will look bad. I'm the health director. But yeah, you can tell people it's starting to like become that behavior where people are like, oh no, I don't have a mask on. I see other people do. So I almost see that as like a good sign that unless he was teasing you guys, I don't think that was the case. But no, it sounds like he was trying to make a good effort. I think we're starting to become ingrained in us and normalized too.
Beth, I know you had a question.
Yeah, I just wanted to say thanks to Megan and to all Department of Health folks, because as you know, Bennington County Head Start, we opened summer programming the 3rd week of June. And the Department of Health has just been so really helpful. As we've had questions, we have questions every week. We're making calls, and we had one last Thursday about whether to include a child who had been to a yellow county outside of the state. And we got an immediate response. We got more information than we asked for. So it was so helpful. We launched this Know Before You Go campaign in pretty quick time, but it gives me a lot of hope for public schools reopening in the fall, that the Department of Health is such an amazing resource and has been so responsive. Thank you.
Thank you. That means so much. I know they're just trying to get ahead of every question, be ready for everything that comes anyone's way. So I'll pass that on. Thank you.
That's good to hear. Definitely. All right. I think I know you need to hop on another call just after 1. Does anybody else have anything quick for Megan? All right. Well, thank you. It was much appreciated.
Thank you.
Thank you very much, Megan.
Meet you. All right. Bye-bye.